Hey everyone, Dr. Evan Katz here. Thanks for joining us. I want to take a little bit of time to discuss what the website professionallyintegrated.com as well as Professionally Integrated, the service, has to offer you. First and foremost, I started this with 16, 17 years of experience where I've treated patients just on a referral type of service. I've never been in any insurance networks, and during that time I've helped a lot of patients that have been hurt, primarily injured in car crashes, and during that time I've had to testify in court over 20 times to really discuss what these injuries mean. Now, there's a lot of services out there that try to teach you, in a sense, how to do PI and how to quote-unquote play the game. That's something that I've never done, and that's something this site is not going to do for you. This site is going to help you become an expert in your community. Truly make it so that people are seeking you out to find out what type of care that you have to offer them, because you're doing something different than everyone else. And that different is understanding what the research is, understanding how the research validates their pain, disability, and how it decreases their quality of life, but also how your treatment can help those areas and those injuries and those patients get better. We're not trying to teach you how to sell something or teach you a sales service. I truly believe, and have built our practice, that just being knowledgeable and giving that information back to your patients is what is going to get your practice and your office to grow. So I want to show you a little bit about how this website works. With the service, as a premium member, you also have access to talk to me and get information whenever it is that you need. But let me show you a little bit of what this site has to offer for you. So now I'm going to show you a little bit about how the site works. I use this site in my own practice, as that's the other benefit with Professionally Integrated, is I'm still in the trenches just like you. I'm still practicing day in and day out. I still love to practice, and I'm still treating patients. This site is certainly slanted a little bit towards patients involved in motor vehicle crashes, because that's when you may really have to show your work, and you may be confined to just the four corners of your notes and what you put or don't put in your notes. However, it's a very strong educational tool that you can use, and you should use, to educate your patients and show them why we're treating. So let me show you a little bit about what the page looks like. At the top, obviously, we have diagnosis, patient forms, legal, videos, different plans. And then let's say the patient comes in and Mary walks in and she has a loss of curve. And you want to, maybe Mary was involved in a car crash, and they're saying, well, how do you know the car crash caused a loss of curve? Well, there's studies that I have down here that show car crashes produce an S-shaped curve. But then you could also show Mary and click on here and say, hey, an abnormal curve actually does make the crash worse if they did have that condition. I do put videos in most of them, so you can not only read the papers and read my thoughts on the papers, but I'll give you my video. But I just show this to Mary, like, hey, Mary, look, it says here in this study that cervical spine deformity is shown to result from major and minor traumatic injuries. And then you can cut and paste and put that right in your notes, and now you can talk about that. All this is, one, from an educational standpoint for yourself, but also so you can help to validate the type of care and treatment that you're giving. Here's another study that you can show that shows a loss of curve increases disc herniations. This way, I like to put in the notes that I'm treating this patient not just to get them out of pain, but to prevent long-term problems. And now I can cut and paste and put a little tidbit into my notes. Here's another study that shows decreased vertebral artery hemodynamics in patients with a loss of the cervical lordosis. First, show our patients this. The information is right here for you. I have patient forums for you to get on, where I have videos on how we do an initial exam and what we put in our initial exams, what the initial evaluation looks like. We have patient protection forms, things that you may or may not need for your office. A lot of legal stuff on here. I have sample expert narratives. I have different terminology. I have different good and bad narratives, as well as information on depositions and so on and so forth. So this site will hopefully help you educate yourself first, so then you can educate more patients, and those higher educated patients on what the treatment is and what it's for are going to tell their friends and family to have them come in. The other beauty with this site is if you are working with attorneys, it's set up where when they come to your office,
you can almost use it as a PowerPoint and show them, hey, are you aware that a Lassa curve that I diagnosed your client with causes increased pain, causes increased degeneration? And you show them this, and you show them what you understand and you know, and it's a wonderful tool all around, from your education to patient education to building your practice and to educating attorneys that are trying to represent your clients so they can understand the treatment you're giving and the injuries that their clients truly have. So please log in, sign up, and I look forward to speaking with you soon.